KVOE AM, KVOE FM, good morning on a Tuesday, and we're pleased to be joined this morning by Dr. Amanda Ruxton, who is with the Flint Hills Community Health Center. Dr. Ruxton, good morning.
Good morning. How are you this morning?
I'm great today. How about you?
I'm well.
Well, thanks for carving out a couple of moments for us. You're brand new at the Health Center. Tell us about yourself, when you started.
So I started at the health center here in the middle of July 21st. I actually grew up in Emporia and have been practicing in Maine for the last 3.5 years. We still have family here, so we kind of decided to bring our kids a little closer to the cousins. I did my undergraduate here at Emporia State University, and then I went to medical school at University of New England, the osteopathic program in Maine, and residency in North Carolina at a community-based program that's affiliated with Chapel Hill, New Hanover Regional Medical Center. And then I've been practicing up at a health center in Waterville, Maine, central Maine area since I graduated. So.
Well, welcome back home.
Thanks. We're glad to be here.
Well, great. Something that sets you apart from maybe some other physicians is that you're a DO. What does that mean?
A DO means a Doctor of Osteopathy, basically an osteopathic physician. It's the same program as an MD or as an allopathic physician goes through. So we still do undergraduate, we still do medical school. The biggest difference is that we do about 300 to 500 hours of training in muscular and skeletal medicine. Initially, back in the 1800s when osteopathic medicine came about, it was designed by a physician who lost several children and didn't have a lot of faith in the healthcare system at that point, and started a program of physicians who wanted to look for health in people as opposed to treating disease with some of the medications that were probably more harmful at that point than they were helpful. I think a lot of physicians at this point really feel that way about treating the whole body, but the osteopathic program is specifically geared toward finding some musculoskeletal issues and developing health in people as opposed to disease.
Dr. Ruxton, what specific practice areas do you have at the health center?
I do basic family medicine, so I cradle to grave. I love pediatrics. I do some low-risk OB, which we're still working out with Newman's. I'll do acute care, some primary gynecology. I do some joint injections, and I do simple derm procedures, so things like biopsies and rashes and some of those things. And then the one thing I probably do that I don't know that anybody else around here does is the neuromuscular medicine, so the hands-on treatment, which is part of the osteopathic program that I mentioned before. It's slight manipulation to the spine and joints, and sometimes just using hands to confirm a diagnosis. There are some changes that can happen in the body that we can feel if we're feeling for them when people have problems happening. So
that is great stuff. So Dr. Amanda Ruxton, a great addition to the Flint Hills Community Health Center. And once again, Dr. Ruxton, welcome home.
Thank you very much.